AHEADinVET is an Erasmus Plus project co-funded by the European Union that aims to upskill VET teachers and trainers in dealing with the mental health of their learners. And you're listening to the AHEAD in Mental Health, Navigating Mental Health in Vocational Education podcast. AHEAD in Mental Health, Navigating Mental Health in Vocational Education is a podcast series that delves into issues related to the mental health of trainees and trainers in the VET sector. Experts in the field of mental health in the VET sector will be sharing their experience and expertise, allowing us to gain a better understanding of the mental health topic. Thank you for joining us and enjoy. I am Lydia Vapula, Project Manager representing Excelia in the project consortium. The second episode of the series was recorded during the third transnational partnership meeting in Greece. Unfortunately, technical problems didn't allow the recording to be of the best quality. Nevertheless, we hope that your listening experience remains a pleasant one. Our guest for today's episode is Assistant Professor, PhD in the University of Rijeka, Aleksandra Stevanovic, MA Psychologist and Psychotherapist. She is employed at the University of Rijeka at the Faculty of Medicine and the Faculty of Health Studies and at the Rijeka Clinical Hospital Center. She is also the co-author of over 20 scientific research papers published in scientific journals and numerous summaries from scientific and professional conferences. Aleksandra represents the University of Rijeka in the project consortium as well. Thank you for being with us, Aleksandra.
Well, thank you very much. I'm happy to be here.
Together we're going to discuss the impact of world disruptive events on the mental health of VET students and lessons learned from the Covid-19 pandemic. So allow me, I have gathered some questions so I can facilitate our conversation.
Sure.
So for the first part of our podcast, a brief overview of the challenges that VET students faced during the COVID-19 pandemic. Could you give us an overview of the unique challenges that VET students were facing during the COVID-19 pandemic in terms of their mental health?
Yes, sure. I'll do my best.
Mm-hmm.
Hopefully, it's always difficult to give brief overviews, but what I would like to start is just describing what this COVID-19 pandemic was, because it's something that truly affected almost everyone in the world.
Mm-hmm.
I mean, humankind is used to adversities. Mm-hmm. It's not something that's new to us. Unfortunately, even as we speak, there are several wars very close by going on. So it's unfortunately not something that we are not used to. Mm-hmm. But this COVID-19 pandemic was very unique because it created significant challenges that we haven't seen in decades. Because it's something that, like the last time we had this big health threat was Spanish flu. And there are only few people still alive, they were born in the beginning of the last century. Wars, they're still going on. Mm-hmm. Different crises still going on. Economic crisis. Now we have environmental crisis. Mm-hmm. So it's not, it's not that we do not know what to do in times of crisis, but this one was very, very specific because, first of all, it was on a global scale. It was something that I think we didn't expect, at least in the Western countries. It was something that we did not think we have to fear anymore. And then suddenly it happened. So it posed many different stressors. It was about health scare, a type of health scare we did not expect, dying from a virus. It's something for Africa. Not for Europe.
Yeah, something that we didn't expect would happen to the developed world.
Yes.
That's the so-called developed world.
Yes, thank you very much. And so we had fear of illness. We had to face actually people dying, close people dying, which could be traumatic as well. And one of the specific of this health crisis was the counter-pandemic measures, which were very much needed. But those themselves created a whole array of stressors. So, for example, you had somebody who got sick, they were in hospital, you could not go in and visit, you could not see your beloved one dying, say farewell, say goodbye. So it was very, very difficult. And in times of crisis that people actually rely on, the most important thing is actually social support. And with physical distancing, that was, deemed that it's very necessary because we have health system crisis as well. We had to preserve health system. Therefore, we had to separate ourselves, keep physical distance. But that basically hit us in our core because that's something that we kind of take for granted, but it's actually the social support that is a very protective factor for many disadvantages in life that we have. So COVID caused multiple stressors, and of course it affected different age groups differently. I do remember that in the beginning it's always like, oh, it's the old people who are going to be most affected by. And yes, that was true because one of the things was that if you had previous illnesses, that was making you more vulnerable to worse outcomes if you get corona, right? But what it turned out to be is actually young people. It's actually students. It doesn't matter was it vocational education or any other type of education, but it was actually young people, adolescents, young adults, because their lives were actually the most disrupted by the counter pandemic measures. So what's very then again specific create difficulties for all students. In-person classes became online classes. We had to do it. So everybody had to make a quick shift. So maybe some schools were better at it because they were better prepared previously, but most were not. Right? Most were not. And maybe one of the positive outcomes of pandemic is that we are much more acquainted with online classes, different forms, resources, and so on.
We became a bit more creative.
Yes, we became more creative. Yes, that's true.
You're listening to the Ahead in Mental Health, Navigating Mental Health in Vocational Education podcast.
So that's kind of good, but at that time it was difficult to make the shift. And what also happened that's very specific for vocational education is this disruption in hands-on learning. So that was stopped. And that eventually created a couple of generations of students, future professionals, who might feel they have lacking knowledge in practical knowledge. So that's, yes, so they have lacked in practical experiences, opportunities. They have faced uncertainty in career prospects, because when this ends and we all go back, we are the generation that has not seen, let's say, patient or whatever other type of, they have not met their future employers. They were unable to make, social networks, contacts, and so on.
That pretty much covers the next question that I had in mind. That what are the most common mental health issues that VET students may have experienced during the pandemic? This is very relevant to what you already said.
Yes. Well, apart from this potential identity crisis, what's the most common was that probably in the beginning, some of the people developed some adjustment issues. A lot of people were under stress, not just students, but parents, teachers as well. So that's what's very specific about this pandemic when it's so globally, because if you're a teacher or a trainer, it's not like you're exempt from experiencing the whole stressors, but you also have the duty and obligation and responsibility to take care of your students. So that's very difficult times. But if we go back to students, all the research, because there was a lot of research, that's one of the good things in this time of age, that we were able to do a lot of research on how people react to this pandemic. And what came out is that there was a lot of anxiety, a lot of depression, and even post-traumatic stress disorder. Yes. There was a whole debate, if pandemic was just a stressor or on a global level, it was actually traumatic for all of us. Yes. I wouldn't say it's traumatic for all of us, but was it stressful? Yes. So it was a big challenge, and probably at the time it was difficult to pull the resources to face it.
That's very interesting. It wasn't exactly traumatic.
It was, well, most of the research, when it started, when you have, first of all, it was done online, right? We were not unable to research that in person because it was not possible. People were asked to stay at home. I don't know, in Greece, can't remember, but in Croatia there was a proper lockdown.
Yes,
you didn't go to work,
except exactly the same.
Exactly the same. So I think that most of European countries had at least one period of complete lockdown. No schools, no kindergartens. It was just healthcare system and groceries for essentials, basically. In Croatia, like, you couldn't even move from where you live to different, few streets down the road. You had to have a special permit.
Yes.
So people say, but what is traumatic event? There's a lot of discussion how to define what is traumatic event. So some say that pandemic as a concept does not fulfill the criteria for it. But yes, most likely for some people it was also traumatic because somebody was ill and they were fearing for somebody's life or their own life. Maybe they had somebody who died. And if they have been, and that's what the research showed, of course, that the most vulnerable group to have a worse mental health outcome following the pandemic is actually people who have experienced some adversities early in life, or if they had mental health struggles early in life, people who are with lower socioeconomic status. Those are all people at risk that an event such as this, prolonged event such as this, will influence negatively on their mental health. Plus, in that period, it was actually difficult to find help and to find resources. Yes. So, but going back, so the research, when we wanted to, ask, how do you feel in pandemic, you have to always reflect on something. So there was a lot of scientific discussion, is pandemic by itself, is that enough to say, is that a traumatic event, or is it some parts of it, not being able to go to school, or keeping the physical distance and so on. So in the scientific research, it was a bit difficult to define, to what do we pinpoint ourselves. Fortunately, there have been some studies done irrelevant of pandemic on mental health of students before the pandemic, during the pandemic, and afterwards. And what we do see is that pandemic did cause elevated rates of anxiety and depression, suicidal thoughts and thinking, yes. And after the pandemic, the numbers went down, but not back to pre-pandemic. Yes. So that's something, but so those are maybe the most common, but there are plenty others. In pandemic, we were also forced to stay at home. Classes started, you were forced to be online. So, but that also increased the time of the screen time, right? The social media time. And some of that is good, it's a way of connecting with others and maybe sharing experience and so on. But some forms are not so good and not so positive, so maybe it's not that common, but I do know that, there are some cases of, people being too much on TikTok or Instagram and so on, and now they feel very much insecure about how they look. There is a resurgence of eating disorders.
They were exposed to other kind of danger.
Yes,
it's the internet.
Yes.
Yeah.
So a lot of challenges. And if we speak of vocational students, one might add this self-confidence and self-esteem in terms of their professional role as well.
I understand.
Because there was a big gap where things stopped. Plus, pandemic influenced the normal psychological development. When you're a student, is it high school, is it later on, young adults, it's something it's about being in touch, getting away from your parents, forming new relationships, new intimate relationships, going out, trying out things, and that was
becoming more independent.
Yes.
Yeah, I understand.
You're listening to the Ahead in Mental Health, Navigating Mental Health in Vocational Education podcast.
Okay, covering this, we've already talked about long-term effects of the pandemic on mental health, but is there something else you would like to, elaborate on or tell us more about long-term effects or anything, any way that world disruptive events might affect mental health in any other ways?
Well, maybe I stressed what happened. I said it earlier that research says that mental health issues got better after the pandemic, but they're still on the rise. And one of the reasons it might be that actually they're more aware of anxiety symptoms and depression symptoms. And there is a surge in numbers of students, for example, at my university, number of students seeking mental health help. So potentially because they have stress-induced issues, academic pressure, and other stressors of living in today's world with all the devices, with being constantly available, with a lot of actually challenges and many demands on young people to do. But one of the reasons that the number has risen is also because people are now more open to look for help. So I would say that even though it still exists, the stigma of mental health issues, I would say that among the student population, it's lower because there has been more awareness and less, shame about having different issues. Of course, that does not apply to everybody, and there are always vulnerable group of people who are more maybe more shy, more afraid of the social pressures, or being labeled, or maybe do not have good family support system to go out and look out for help. So what we have to keep in mind from now on, from the perspective of mental health professionals, there are going to be a continuous level of students with depression and anxiety in higher numbers than it was before. But all in all, what I want to stress out is that people are very adaptable, right? So that's our good side and maybe sometimes the bad side, because we get used to things. So we get used to even bad things in life. So after, whenever something stressful, traumatic happens, our bodies, our organisms, they produce a response which is maybe seems inappropriate at time, but it's actually appropriate to the unexpected change in the environment, and in time we go back to normal. Although what is normal, maybe it's the new normal, maybe it's the old normal, and so on. So most of the people do recover. And one of the things that we do know is that people are very resilient. And it is the stressful events that actually make us, like you said in the beginning, they make us very creative. They make us find new solutions. They make us find new coping strategies. So it's always also a place of opportunity to do something different, to do something new, to improve. So resilience, in a way, is a part of being emotionally stable enough not to be affected negatively in the long term, but also traumatic events, stressful events can make us become more resilient in the future.
That's what we had as a topic in our first episode, and in fact, this is essentially the silver lining in all this. That
yes,
we actually were trained through the pandemic to face those kind of challenges and overcome them in the end.
Yes, and it's when you think about it, it's actually it's so difficult when people experience stress and trauma. They very often wish for themselves because they experience they're not feeling themselves. They're more anxious, they're in fear, things have changed around. So very often people want to, I just want to go back and be the old one. But that's impossible. We're never the old ones, we're always the new ones. So these events which are outside the box can actually have many positive consequences. But what world disruptive events do have long-term effects. which are usually maybe they're more easily accessible on the individual level. After each such disruptive event, we always have a certain amount of people with post-traumatic stress disorder or some other mental health or other health issues. Well, majority, gets along, but we do keep on having these vulnerable groups, which kind of mirror what everybody else was going on. And when you think about it, there are entire generations that identify themselves with being a war children or post-war children. So maybe in the future we will see better, because it kind of feels like it's old story pandemic, but actually it's not.
It's not at all.
So sometimes we do need this time passage to look back and see what is the true long-term effect. But even today, I can see, I meet students and they say, oh, we're the online generation, and there is a feel of sadness in it, a feel of loss of not being able to study the way, they expected to study. You go in school and you expect to do things which somebody says like, oh no, you cannot do it now. Everything has to stop. So, so we will see in time, how this generation
was affected in the end.
Yes, yes, it's not going to be the newborns. For them, it was nice. Moms and dads were at home, but students potentially will see that in the future. But every world disruptive event, is it a natural disaster? Is it a man-made disaster, which are very common, unfortunately?
Unfortunately,
they do have negative consequences, but they also have positive ones.
Fortunately so.
Yes.
So how do you think that VET students and institutions could prepare for war disruptive events and address the long-term effects or even the short-term effects?
Well, it's always the best thing to do is to work on mental health now. Because if we know that people with previous mental health issues are at higher risk of worsening of their symptoms, of worsening of the functioning, and so on, if something disruptive happens. So we want to, we want to be healthy now. If we are healthy now, it will be easier for us to face any future thing,
any event
that might happen. Of course, it's not ever going to be, one through one. I'm not saying this maybe properly in English, but you cannot always save everybody. But we have to build health now, when the crisis is not here. So, what vocational educational systems should do is they should do strategic planning. They should work on resilience building, and they should implement more some type of supporting measures. So what should a strategic planning include? Of course, if some crisis hits, we should all be prepared in, where to look for help, maybe to have in mind, like if in general if this and that happen, what are the steps to move again to online classes? What have you learned? Can we implement something else, not just maybe tasks, but let's make some group support, mandatory classes for everybody, or organize even today some peer supports between students, but also between teachers and trainers, right? To be prepared, but to have it already here now in mind, like now, first Monday in the month, let's all meet for an assembly where we are going to talk about whatever issue, or maybe have a workshop on some topic and so on. And then in times of crisis, we will make that a weekly thing or a daily thing, or so to have some guidelines in mind what to do. But basically to work now in the present on mental health. And how do we do that? If somebody has serious depression or panic attacks and so on, it's hardly going to be teachers and trainers going to cure them. So educational systems should be connected with professional help, of course, with health systems. They should be connected with the local community, especially in vocational systems, to have local partners for the work placement and so on. But they can also, again, work on mental health literacy as well, right? To offer seminars, to offer workshops,
That's very important.
Because with the crisis hit, everybody's under crisis. Everybody's under crisis. So if you're well prepared, it's easier to function because our minds, our bodies work differently when the crisis hit. But what also happens in their crisis, very often it brings people in a way closer. People are actually amazingly in wanting to help others when crisis strike. That does not last too long. Again, we adapt, so we stop doing it. So we should be prepared. We should be prepared and work on um, knowing where to seek help, knowing the basic principle of psychological first aid, because psychological first aid is a way of dealing, working, behaving in crisis situation, and it's called psychological or psychosocial, but you do not do any treatments. What people in crisis and in disruptive events need is actually social support. They need information. They need people who say like, look, I'm here, whatever you need. If you want to talk, I'm here. But, let's make sure that you know where your family members are. These are the numbers you can call. Do you have food? Are you cold? It's the basic needs that must be covered. Not to have in mind that, that we have to do, you know, it's a period that we all have to survive and just to take care of each other as humans. So I would suggest, no, I will suggest that later in the interview. Okay.
You're listening to the Head in Mental Health, Navigating Mental Health in Vocational Education podcast.
So, Aleksandra, how can VT teachers best support their students? Do you have a more specific direction of what they could do during these times?
Um, well, specific, it's a bit difficult to say because it really depends on the nationality or on the nation country, right? Because each schooling system is different and mental health resources are different, although in Europe we do share the same common thread between countries as well. So it's very difficult to speak about specifics. I will have to just stay in the general terms because maybe the general message, I think it's more important to keep in mind. I would say that teachers and trainers and vocational educational assistants in times of crisis should try to create stability for students as much as possible. Just to, of course, in that we have to be flexible and change maybe create more flexible learning models, give out flexible deadlines, but to try and keep on being the firm point in people's lives, even though that can be difficult because teachers are people affected by crisis as well, right? Systems are affected by crisis as well. But just to be there, to be the stable point, something that does not fall apart, something that the students can come and ask for help, not necessarily psychological help, although I would say most of European schools do have the system of having um, school counselors, whether psychologists or some other type of mental health professional that are, they do know what to do in psychological crisis. But and schools can be a good point because today online we have so many things. There's so many like mental health applications and mental health programs, and there are many individuals, but even organized groups providing mental health support. Maybe the school can help in saying like this application is good. We checked it.
Mhm.
You can use that, to provide, maybe they can apply some of the existing mental health programs in their school setting as well. So the school should be informed so they can inform the students as well, and to inform teachers, trainers, and all other school staff members. And the usual, it's like an airplane when they teach you if something happens and then the mask falls down, you have to put first oxygen in your face before you help children. So teachers, trainers, and anybody involved, who works at school, they should take care of themselves as well. So they should take self-care and think of stress management for themselves as well, and all the advice on supporting students, creating peer support groups for students and so on, that goes for them as well.
Yeah, that's very important. And I guess that in order to use resources, which of course might be national or local in character, they could create resources, but only if they have managed to create an environment for themselves,
Yes,
supporting themselves first.
of course.
Yes.
Yes. It's one of the things that maybe we will get from this crisis, pandemic, but also other crises that are going on at the moment, because there are many. One of the things that maybe is going to happen, that more and more of mental health will be implemented in curriculum.
Yeah.
I never know if it's curriculum or curricula, this Latin plural, but I hope you know what I mean. So I think we are going into that direction, and more mental health and health in general. Maybe we shouldn't even divide mental health and health. Is going to be involved in curriculum, where it's going to be something that we speak about on weekly basis, daily basis, something that will teach us in advance how to deal. And of course, we can expect um, people having emotional reactions to disruptive events, whether it's on an individual level, because that goes on daily, and teachers do know that, like it doesn't have to be a global crisis. People do go through private crisis as well, individual traumas as well. So teachers and trainers are actually very good in recognizing who are students that are more vulnerable, right? So they can pay more attention and provide more specific help. Again, I'm not saying the teachers and trainers who are in a way overwhelmed as well should take that role as well of somebody who is treating and healing. No, of course not. But it's very important that they do recognize if somebody's suffering, and know ways where to refer somebody, what are the resources out there, just to be more aware of that. And the higher the health literacy is, together with the digital literacy, which I think it's also very important um, that we have to keep in mind also for any future adversities and crises and so on. It's something that will basically prepare us and make us feel more safe and confident in times of crisis.
I see.
You're listening to the Ahead in Mental Health, Navigating Mental Health in Vocational Education podcast.
This was an amazingly interesting conversation about the impact of war disruptive events on the mental health of VET students and the lessons learned from the COVID-19 pandemic. Joining us today was Aleksandra Stevanovic, assistant professor, PhD in the University of Rijeka, and MA psychologist and psychiatrist, and also representing the University of Rijeka in the project. Thank you very much for being with us today, Aleksandra.
Thank you.
Do you have any last thoughts about today's topic?
My last thought about this topic is that adversities will happen. They happen every day, and we are going to face another global pandemic in some time, or other disruptive events. Those are not, unfortunately, we cannot avoid those, but we can prepare by creating more inclusive environments, to talk more freely about mental health, to do activities which promote mental health. And when the crises do strike, just keep in mind to keep in touch, to keep in personal touch as much as you can for yourself as a teacher or trainer, and to keep in touch with your students. And eventually, for most of us, in time, we actually grow from adversities.
That's a
Yes,
straight up
yeah.
to keep in mind.
But also, I do want to mention, and I know you will be saying that as well. AHEADinVET project, it's going to create a lot of resources for teachers and trainers in vocational education that they can rely upon in the future.
Yes, yes, indeed. It's an excellent project.
Thank you for listening to the Ahead in Mental Health, Navigating Mental Health in Vocational Education podcast, a series produced as part of the Erasmus Plus project AHEADinVET. Remember, mental health is an issue for which conversations need to continue, evolve and flourish, and together we can create a more compassionate and supportive VET community. For more information about the project, feel free to check out our project channels and follow us on Facebook, Instagram, Twitter and LinkedIn. Find out more on our website www.aheadinvet.com.